Yeah, I mean,
again,
I guess I'm looking for little milestones that will let me know that things are improving.
and
Other than
yeah,
hopefully I feel
well, and so
good,
this is, yeah,
feel
you're gonna
better.
feel better, and that's probably the biggest one, right?
Because, like, I haven't been out of bed since my discharge in July.
Okay, well that's,
I can't.
yeah,
I
okay.
had to bring a friend in to just do little, like,
Okay.
feed my cat.
But you should be up and moving. You should be walking here in the hospital, right?
I can now. I couldn't
Okay.
before
Well,
at all.
well, maybe just a bit of IV fluid has been a lot to help you out. Although
Yeah,
all your blood work
true.
looks good, like your kidney function, everything else is fine. So you're managing to get enough
And what about my
nutrition.
liver? Is my liver
Liver
going? What the
functions are
fuck?
all normal.
Yeah?
They're all normal right now. Yeah.
Okay.
So, so let's see how you feel after we get this drain. Okay. So you're gonna be
So
with us
when
for
is that? Tomorrow?
hopefully tomorrow.
Okay.
Okay, there it's in the system.
Okay.
Again, it's everything's about priority, and if someone comes in with life-threatening,
Yeah, yeah.
then they go first. But
Yeah.
otherwise, you should be done tomorrow.
And
We'll see you
like
first thing
probably
in the morning.
Friday for.
I don't want to even tag a day because who knows how well you feel after it's done.
Well, it's not how well, like you're saying, like the fluids and all this boosting I get here. Then I get home and I feel like crap.
Yeah, but let's worry about the problem at hand, and
Yeah.
we'll talk about when you go home after, when it looks like it's going to happen.
I
Okay,
need
we'll give
to
you
be able
plenty
to
of
check in
days.
with you sooner than 3 weeks
That's fine.
or something.
You can just call and come and see me sooner as needed. And of course, when you have a setback, everything all like
I sometimes don't know if it's a
yeah.
setback,
Well,
but you know what I mean?
Yeah, this has been a major
All I
setback.
know
Yeah.
is that I didn't feel well
Yeah.
for
And
4 weeks.
But this is a major setback.
Yeah.
So let's see what the drain does.
Okay.
We'll see what the next 24 hours holds while you're here.
Okay.
Then we can start to think a little longer reaching about the next steps
Yeah.
and where you go and everything else.
Like
Have you
I'm
had any contact with Providence yet?
Yeah,
The
I've kept
dietitian?
them in
Okay.
everything got rescheduled because
Yeah.
of the
Yeah,
second
because the second
surgery and
operation,
stuff.
yeah.
But
So, or maybe a piece of paper, we can probably draw it. Might be better for you.
video.
You'd be able to
Okay.
with a diagram. And so what happens is when we reconnect,
do that fan thing
fan
again.
like this, and we divide the bowel. We divide it like that. So you have one end of the bowel here, one end of the bowel there, and so you get two ends that are open. Now we take those ends. One gets attached to
And
the
then
stomach.
it's normally all one.
Normally it's just one straight line.
Okay.
So remember, I told you in the office, we make a letter Y.
Yeah.
When we make the Y, one arm goes up to the stomach. Gets attached where the stomach is.
Right.
That was all fine.
Yeah.
The other arm gets attached to the bowel again to create the Y. Okay?
Right.
Now, when we have that creation of a Y, where we create it, there's still a little hole, it's called a defect in the what we call mesentery, or the blood supply to the bowel, and it's literally like this. So at the end of the operation, we close that.
Okay.
And the reason we close it is if we don't, then the risk of getting an obstruction for a different reason, because bowel, which is
It will go all willy nilly and.
yeah, it goes right through that opening, and you get what we call an internal hernia. So we close it and we cinch it down tight so that the bowel can't go through. At the second operation, it appeared that that's what was, by cinching it down, we were causing kinking of the bowel around that cinching, and that's where the blockage was. Because as soon as we just cut the stitch
Yeah.
and pulled it
Remember
out,
you saying that.
yeah, then the
Then
bowel
it was
opened
just
up, and then we could see it all going, like the two arms of the Y were all blown up like a tight balloon, and beyond the Y, it was normal bowel. So we know that's the site of the blockage. Once we
Now, you also had said at some point that there was a small hole.
there was a hole
Was-
in the bowel. Yeah, that was getting in with our camera because the bowel was like a tight balloon, and so a hole in the bowel happened. We sewed that up.
Okay.
Okay.
Yeah.
So when that hole happened, there was leakage of stuff from the bowel.
Right.
Liquid.
Right.
And so then we spend time to clean all that up.
Yeah.
And that's what this abscess is about. Okay. But undoing the blockage was key.
Yes.
Cutting that stitch was key. Now, what we did is when we finished, we sewed it back up, but not quite as tight.
Right.
Okay.
And is every body different and how?
Yeah, a little bit, but
Yeah.
but this operation is remarkably similar every time we do it. I've done
Yeah.
like almost 3,000.
Yeah.
So it all looks pretty similar.
Yeah.
You cinch it down. But we know, and the irony is often we refer to this.
Yeah.
It's some surgeon named Brolin, the anti-obstruction stitch of Brolin. And tongue
The one where you're cinching it down so it doesn't come through.
So it tries to lie the bowel straight. But in fact, and so we've had discussions around the city because this happens, like I told you, probably 1%, something like that.
Hello.
Probably less
Enter Dawn.
than that for this
Yeah.
to have a quick obstruction like you did. But we've discussed this across the city at the bariatric centers, and we often refer to it as the anti-obstruction stitch that's been known to cause obstructions, right?
Right.
But for 99% of people, it's an important thing because internal hernias come down the road and they can be more of a problem.
Okay.
So it was something to be fixed. Now, that we got a hole in the bowel was no good, obviously, because that all of a sudden now we have a risk for infection. So we dealt with
And
the
meanwhile,
obstruction.
my body was like, I don't feel well.
Because you were blocked. That's why you felt awful,
Well,
right?
it also was like nausea,
You're blocked.
lethargy. No, I was still pooping, but
But
it
that
was
doesn't mean you're not blocked.
right.
You got 18
Well,
feet of intestine.
the reason I came in is because I was vomiting
because
like
you're blocked.
nonstop.
So anything you were going, it wasn't
Right.
That's why you felt as bad as you did, and that's why we took you to the operating room
Right.
after we got the scan.
Yeah.
Now, so after the second operation, we know we clean out the abdomen as much as we can.
Yes.
We'll wash it out, suck out any fluid we could see. We take it all back.
Yes.
But we know if there's some abdominal, like digestive fluid in the abdomen, that's got bacteria in it. We know that. And
For sure.
We know we don't get all the bacteria out. And sometimes, as in your case, that bacteria sets in
Entered on.
and it could
Yeah.
multiply and form an abscess. And that's what you have. Now, the abscess probably caused some of it's certainly causing your discomfort. Your blood work's a little bit abnormal today. That's from the abscess.
Meaning, like
Your
my white,
count is
yeah,
up, and it's
okay,
up because
yeah,
there's inflammation.
and it's fighting. Yeah, I mean the ER doctor, I forget his name. I called him Dr. David. He got at the chest scan first,
Yeah.
and then he's like, I think we should go with this CT
Look at the
scan.
abdomen.
Yeah.
Yeah, chest X-ray.
Yeah.
Which is,
And so that's when, knew
that's
for
when
sure
we
that
see
it wasn't just pneumonia.
and so
So I have both pneumonia.
I don't
and
think you have a pneumonia. I think you have
I don't know.
and some splinting of the lower lung because you have an infection underneath the diaphragm.
like
So-
that cause coughing and
It can, you don't breathe well. When you don't breathe well, you don't have it. Is it a big productive cough? Now you're going to get some
yeah, like it
antibiotics
was
anyways.
the postnasal drip,
Yeah.
but all the time.
Yeah.
But my GP had given me that spray Amaris or
Okay,
something.
yeah.
And so I was using that. Usually that would just stop
Clear
it,
up,
right?
yeah.
Never worked. And then the cough was not like the pneumonia cough. It was like a almost like guttural, and would only be like white
Yeah.
saliva, foamy, with a little bit of green every now and then.
So
Then I couldn't stop it. When you
Yeah.
can't, once you cough, it just,
So my suspicion, what I suspect is going to happen,
yeah.
is we get this drain. If everything goes uneventful, now they'll use a scan to guide it or an ultrasound, whatever they think is best. They'll make their own call on that.
Now, what could go wrong?
They're going to talk to you about it, but if they poke something, they get bleeding infection. Every time we have an intervention, there's a risk for that, right? Every time we go through the skin, bleeding infection are potential.
I need you to tell them, don't do anything. Don't compromise this girl anymore.
They don't need me to tell them.
I
The
know.
last thing they
I
want is
need
to
you
make
to
anyone.
tell them for me.
Yeah. They're excellent at it. We have very good interventional guys. That drain goes in, the fluid comes out. You'll notice
So they
Immediately.
pierce it
they go into it, and then they'll take the fluid out, and what they'll do is
so they
yeah,
suck out the
and
fluid,
leave
and
a
then
little
the drain.
a little tube that's in there. And
Okay.
that drain will be there, and we'll watch you for a day or so,
Mm-hmm.
see how you're feeling. You should feel notably better within 24 hours. Okay?
I mean, I've been nauseous every single day since
Okay.
the
But
first
yeah.
operation.
But I mean, you've
I've been
had
on.
problems. Yeah, you've had problems ever since, and we're not
Yeah,
at the
but
end
you
of it.
don't know that
Yeah.
right at first.
Sure.
So I'm just like, is this what my life is going to be because of
No,
this
no, no, no,
surgery?
no.
Like, I just hadn't read anything
These
about
are,
nausea
yeah,
every day,
yeah.
diarrhea, and like knowing that you're going to have diarrhea and then this little piece comes out and that's it. I couldn't
Yeah.
eat anything.
This is not a typical course.
Okay.
So you can expect that once we get over this, and now I can't guarantee you if this is going to be a drain.
I know.
A few days of it, out it comes, and then life's wonderful. That's what we're hoping for. But